Good evening and welcome to Arizona Illustrated for Monday, the 2nd of July, 2012. I'm Tony Paniagua. Border security and illegal immigration are major concerns in much of the southwestern United States. And the worries have often led to controversial proposals in regions of booming Latino populations, which create a new set of conflicts in some communities. Tonight, we bring you part of a special town hall which Arizona Public Media recently held with our sister television station in San Diego, as well as Gwen Ifill from Washington Week.
It's one thing for us to theoretically wonder what the reaction is, but you've got some people there with you who can tell us a little bit about what they thought about this, what the Supreme Court did this week.
Sure. We've got Cochise County Sheriff Larry Deaver. Cochise County sits right on the Arizona-Mexico border, and he's been sheriff there nearly a decade, and he can talk about the impact of the law. What's your reaction to the ruling this week?
Well, a couple of things. Cochise County in Arizona is in the same situation that San Diego was in the late 80s, early 90s, and we're trying to get a hold of that. The other thing that doesn't make sense, Andrea, is when it comes to gun running prior to Fast and Furious, kidnapping, murder, drug trafficking, everything else border related, the federal government embraces us. And when it comes to immigration, they not only say, you can't touch this, they sue us when we try to help and stand up and take our part in that role. To me, that says this is a totally politicized issue, has nothing to do with anything else other than politics. And in the meantime, the people in southern Arizona are suffering the consequences of unfettered and unmitigated cross-border trafficking.
Andrea,
and the people who are being trafficked are also victims. People dying in the desert, people being sold into prostitution, people being sold into slavery to pay for their fare, and it's just an absolute travesty. And to try to turn your back and just say, well, these are just innocent people trying to come across the border, there's a whole myriad of crimes associated with that.
Well, Sheriff Deaver, I want to turn to San Diego and Amita there and find out whether he made reference to the fact that this is where San Diego was in the 80s. Is that right, and is there the same kind of tension?
No, there isn't the same kind of tension. In fact, proportionately, San Diego is actually third compared to other California cities in terms of the number of illegal immigrants. They comprise about 6.6% of the total population here, and I think the average for California is a little over 8%. So yes, the number of illegal immigrants within this area is down.
Let's talk to Peter Nunez about that, who's down there with you.
Yeah, Peter Nunez, so why do you think the number is down within this area?
Well, beginning in the 90s, we made a strong effort. Gatekeeper was the name of the program, and you saw some of it in the tape that we had fences, more border patrolmen, more lights, more cameras, more attention, and we made it very, very difficult. We cut the numbers from about 500,000 arrests a year to about 100,000 arrests, and now that's even lower today. So strict enforcement on the border worked. It's more difficult when you move to the rest of the border for the reasons that the sheriff pointed out. You have vast miles of desert that are more difficult, and the federal government has not paid as much attention there as they did here in San Diego.
Juan, I see that you're nodding along with that. Is that the same thing that you found in your reporting?
Yeah, and the interesting thing about that is that one of the things that the Border Patrol did a real good job of showing off to me was this new command center that they set up in Tucson specifically to plug that hole. I think that the Tucson sector is probably one of the last ones that the federal government actually paid attention to. I mean, you remember after 9/11, there was a whole influx of troops down at the border, so they took care of San Diego, they took care of the Texas border, and then the Arizona strip was the one that was left. So they actually have they have a commander there who's taking charge of putting together all their operations.
Andrea, back there in Tucson, it's a complicated issue. You're there with Bruce Bracker, who has a slightly different point of view about this whole enforcement issue.
That's right. Bruce owns a department store in Nogales, another border city. Nogales, Arizona bumps right up to Nogales, Sonora. And Bruce, you were just nodding, or actually shaking your head, listening.
I was shaking my head when the mention of Joint Field Command. And for us on the border, the Joint Field Command has not been a good thing. It's taking resources away from where they need to be, which is at the border. You have customs of CBP officers and administration being pulled away from the border, and the same thing with Border Patrol, and we're much better using those resources at the border. We feel that the people in our community in Nogales feel that the Joint Field Command is not a good thing. For me, the way, and for our business, what's going on with the border security is there's really two questions what's happening. One of them is what's happening in the field, and that's what's happening with Border Patrol. The other one is what's happening at our ports of entry. And quite honestly, our port of entry are lacking staff. In Arizona right now, you could use 500 new customs officers, and if you got them here tomorrow, we would probably have just enough capacity to move the legitimate trade and legitimate customers and people that want to move through the border at a reasonable time frame.
I really want to ask Fawn and Pete here in Washington. We've just heard a lot of pretty significant concerns from folks about what Washington is not doing and how government is not stepping in to help them speak to their concerns. How much of that does bubble up here?
Well, of course, you have to remember, members of Congress hear this all the time from the folks at home, and they say a lot of these same things, too. And I think that's one of the reasons why things aren't happening here, is because you have a border state, especially Republicans, pushing for stricter enforcement. They're not willing to see any changes in immigration law on questions of citizenship or a DREAM Act, anything like that, until there is more done. They're still not satisfied that there's enough enforcement at the border. And the administration believes right now they've done as much as is reasonable in terms of enforcement.
And I mean, the thing I love about this conversation is that it's true that the members of Congress here actually do hear about these kinds of things, but not in this level of detail. What you hear in Congress a lot is that this is a jobs issue. I mean, you hear that no matter what you're talking about, especially if you're in the House. But they keep on saying that the illegal immigrants who are here are going to take people's jobs, which is really just a platitude that ignores a lot of the really much more complex issues that our panelists in these two cities have laid out. What I'm interested in also is that what you're not hearing from what they're talking about is the ins and outs of SB 1070. They're worried about whether or not the border resources from the federal government are being put in the right place. And there's arguments on both sides of that. They're worrying about their businesses. Are their businesses being hurt by the expansion that's going on here? Exactly. And it's almost like this conversation that's going on in Washington about whether or not you should give a police a routine idea of checking someone's ID or have it be ad hoc is completely.
I would also say very briefly is a budget issue here too.
Right.
Because everybody there would like to have more folks on the border, but every federal agency would like to have more.
Well, and if you look at the funding of DHS, I mean, it went like this. It went up and up and up, and finally, I think that the budget guys are just like, we can't do this anymore.
I want to get back to our panelists in San Diego and Tucson because there's another big elephant in the room here, and that's the politics of it. Leticia De La Vora in Tucson, there with you, Andrea. She's been very involved in that.
That's right. Leticia is director of One Arizona, which is a group of several nonprofit organizations that actually formed after 1070 passed in 2010 and works on Latino voter registration. Leticia.
Right. We formed shortly after 1070 was signed by Governor Brewer. And a lot of what we're hearing here at this table and in San Diego is how SB 1070 is impacted at the border. We're a statewide coalition, and if SB 1070 were specifically about securing the border and protecting Arizonans from drugs and heavy criminals, that would be fine. But SB 1070 is statewide. And that means a kid walking home, after walking his girlfriend home, he's walking himself home, 15 years old, he could be stopped by a police officer and asked what he's doing. If you're 15, what kind of ID are you going to have as a U.S. citizen? I didn't have an ID when I was 15. I could fit that profile of, they look suspicious. If your skin is dark enough, if your accent is heavy enough, and a police officer has a personal axe to grind, I think that's the real issue for U.S. Latinos and naturalized immigrants, that they fit that profile. And that's scary, that we could be considered guilty just because of what we look like. And that's the most onerous part of SB 1070 was what was upheld. And I think it was Pete that mentioned, that's what people are going to be watching for. We're definitely, as U.S. citizens, going to be looking at how are we treated as a result of SB 1070 being implemented. And we want to be treated with the same respect that, Sheriff Deaver and his sons or you all get when you're walking down the street, where we're not immediately suspected of being here illegally. And I think that's the real issue many Latinos see as people of color, that was really the heart of why we took issue with SB 1070.
We have time for one more comment from San Diego and one more from Tucson. I'm very curious, going back to you, Amita, if there's anybody there who thinks that Washington is more of a help or a hindrance.
Pete Nunez, I think that might be a question for you.
Well, look at this. The immigration problem has been bought and paid for in Washington beginning in 1965 when Congress passed the current immigration law. And notwithstanding lots of complaints and effort and tears and travail since then, Washington still refuses to enforce current law, let alone fix the law that we have. To go back to a point I think that Pete made, the big elephant in the room is special interests. That's why things don't get fixed. There are too many different groups that profit either economically or politically from the current status that we've experienced for the last 30-some years. And until the people can sort of overcome these special interests, we're not going to solve this problem.
Okay, yeah, I just wanted to go to Tucson for one more thought about that. Washington, hindrance or help? Anybody in Tucson, briefly?
I'd just like to say, Leticia, you're a great person, but in my 36 years in law enforcement, I've experienced or seen one claim of racial profiling. SB 1070 won't change that. And that claim was determined by outside independent investigators to be unfounded. SB 1070 isn't going to target Hispanics, people of color, anything. We are in the business of profiling in law enforcement, but it's criminal profiling, has nothing to do about nationality, race.
And you can watch the town hall in its entirety on our website, azpm.org.
Hi, I'm Mark Wahlberg. Atlantic City shows off its treasures when Antiques Roadshow comes to town.
To a non-folk art person, this is probably ugly as a mud fence.
This entire guard is made of solid silver.
Oh my goodness.
Really?
Oh my gosh. Really?
Yes. Don't miss our visit to Atlantic City next time on Antiques Roadshow.
Tonight at 9 on PBS 6.
Millions of people remain surprised and angry about Friday's U.S. Supreme Court ruling, which upholds most of President Obama's Affordable Health Care Act. And while many Republicans are vowing to repeal the law if they get the opportunity, some patients are sharing their stories about why they support the legislation. Tonight, we are joined by Tucson resident Gail Freyer, who was very worried about not being able to find health insurance before the law was approved. Gail, thanks for being here.
My pleasure. Thank you.
So if you could tell us a little bit about your personal medical situation and how you ended up in this case.
I am an insulin-dependent diabetic. I have been for many, many years, and the health insurance issue has been a long, long fight and worry for me. Because of the insurance problems, people with my condition and many, many others are disqualified from obtaining health insurance. And I have been writing politicians and making points on the radio and newspaper for years about this. So it's not a new problem. The country's been battling this for a long time, as indeed have I.
So you are self-employed. You were telling me right before we started this interview. How did you end up getting health insurance finally?
Well, thanks to the Affordable Care Act, I was able to apply to what's called the Pre-Existing Condition Insurance Plan, run by the government, and I had to be without insurance for 6 months. I had to be a citizen of the United States or legally here, and I had to have validate that I did have a pre-existing condition. and had been rejected by insurance companies. My physician helped provide that information, which is what they required.
So prior to this program, which you started on January 1st of this year,
Right.
did you approach 550? How many companies, and what did they say as far as trying to get some health insurance?
Well, I did attempt to round up insurance from other areas, but the first thing, one of the things I attempted to do was to get just catastrophic insurance, because I knew that no insurance company would cover my diabetes. So I thought, well, at least I could get them to cover anything else that might happen to me and just disregard the diabetes. And one of the first questions they asked me, of course, was what my health situation was. And once I told them, they indicated that they would not even underwrite for catastrophic illness.
So you had to be without insurance for 6 months in order to qualify for PCIP. What was that like?
It was awful. It was frightening. It's a terrible way to live, particularly in a country like this where our medical care is very costly. You feel as though you're walking on eggshells, and if you have a car accident, if you had a heart attack, no matter what, no health insurance, no coverage.
And so what do you say to those people who are now trying to repeal so-called Obamacare, the Affordable Health Care Act? What would you say to him or her?
Well, I find that it's until an individual is actually confronted with being without health insurance, it's hard for people to truly appreciate the fear that we live with during those times. But I also would hope that people would have a better sympathy for the people of this country, regardless of race, religion, income, just a basic human right of receiving medical care in a country that's powerful and wealthy as the United States is.
So do you think as part of this law, I guess the point of contention for many people is the fact that we sort of, people are forced, if you will, for lack of a better word at the moment, to buy health insurance and also pay a tax? Do you agree with that portion?
The only way, to my understanding, that this system can operate properly and fairly is for everybody to participate. So if you're going to make allowances for this one and that one, and you're not going to have the whole community, and this is really needs to be a community, countrywide effort to enable everyone to be insured, regardless of pre-existing health conditions.
And then what happens if this is repealed? What would happen to you?
I will have no insurance. Once again, I'm back into the market of trying to round up insurance from private companies, and they are not interested in underwriting me.
You say you've been dealing with this issue for several years. Are you trying to be more vocal about it so more people can see your story?
Yes, I sent a letter off to President Obama the beginning of this year to thank him for this coverage because it was an absolute godsend for me. I sent a letter to McCain and expressed my sentiments also with him. Over the years that I've been in Tucson, I've addressed this issue with newspaper stories, and I shall continue to fight for what I believe in as being very important.
Okay, well, Gail Freire, thank you very much for joining us, and good luck to you.
Thank you very much.
Appreciate it. We continue the conversation about this topic with the Chief Medical Officer at Arizona Connected Care, along with the CEO of Tucson Medical Center. Michael Chihak has that interview.
Now for the impact on healthcare, I'm joined by Tucson Medical Center CEO Judy Rich and physician Richard Johnson, Chief Medical Officer of Arizona Connected Care. Welcome to both of you.
Good to be here.
Ms. Rich, what does the Supreme Court's decision on the Affordable Care Act mean for Tucson Medical Center?
It means that we have received affirmation that the plans that we've put into place for the last few years will continue just as we had planned. We've been working for quite some time on creating a system of care that would coordinate care better and would manage our population to actually keep them out of Tucson Medical Center. So it's been our strategy and our plan for a long time to really build on the Affordable Care Act.
And part of that process that Ms. Rich described, Dr. Johnson, is the program that you run as Chief Medical Officer. And it was funded under or created or authorized under the Affordable Care Act. Tell us a little about that program.
Yeah, the program is actually designed to bring the best care to every patient every time. And the Affordable Care Act does definitely help because a lot of those patients are unreachable right now simply because they can't afford health care. The other interesting thing about us, and I think that it's important that people in Tucson at least realize that what we're doing with the Arizona Connected Care here in Tucson is a prototype that can be used in the rest of the country because it's not a giant unified healthcare system that already runs everything. There's a group of people and a group of physicians and a hospital that are all working together to try and enact those changes to make healthcare better. I think one of the things that Judy just mentioned that's a very key factor that most people don't realize is that Tucson Medical Center, in a very real sense, is engaged in a process and helping to fund a process to help people stay out of the hospital.
Now, keeping them out of the hospital is a great thing, but when they do need health care, they have to pay for it, or someone has to pay for it. And that's a big factor in the Affordable Care Act. Is this going to bring out more financial viability for health care?
It's good news for hospitals because we now care for everybody who comes through our doors, regardless of their ability to pay. And the individual mandate that was upheld by the Supreme Court really gives us the opportunity to start working on how to give 30+ million people a form of insurance that will pay for their health care. And we're very excited about the fact that we can now stop debating the individual mandate and really set about putting it into place and figuring out how to do it and how to make it work for the most people.
Now, Dr. Johnson, when it's in place and people are getting health care, give us an example, perhaps from the patient level, of how your program helps people to stay out of the hospital.
Good question, Michael. And one of the things I'll have to start off with is dovetails with what Judy just said, which is that one of the single biggest problems we have as providers is patients who don't have medical insurance, cannot afford the basic medications they need to take care of their chronic diseases, can't afford to receive the kind of care they need for preventative health, and help stop them from ending up in the hospital or in the emergency room where the most expensive care is given. One of the things we really focus on is providing the right care for the right patient when they need it every time. That's really the heart of what Affordable Care is about, or Arizona Connected Care is about.
And funding for that program, is it coming from the Affordable Care Act?
Not directly from Affordable Care Act as much as it comes from the payers, including CMS and Medicare Advantage, etc.
CMS is?
Medicare,
okay.
Medicare, Medicaid, Center for Medicare and Medicaid Services. They are actually providing income that we share some risk for them if we can provide care for these patients that's the high quality that we expect to give and that meets their standards, and at the same time is done for less than what the expected care would be. There are some shared savings that they share back to the providers and the hospital here in Tucson.
Ms. Rich, one of the things that Dr. Johnson touched on was the federal government's involvement in health care. And there are those who say that the government should be out of it and it should be a free market system. How do you feel about that?
Well, it's really tough to say that when we have so many people receiving Medicare benefits. I think that there's a time in your life when you can maybe philosophize about whether the government should be providing health care or funding it. But once people get to the age of 65 and they realize that they're no longer employed and they're retired, and they really want a very affordable, good system of care that gives them access to all physicians, Medicare looks pretty good. And the challenge for all of us in healthcare is to take the dollars that the federal government has put into Medicare and really spend them wisely, to only put them where they're needed and to not over-treat patients and to keep people home if they can stay home and in the hospital for acute care.
We have about a minute remaining, and in that time, Ms. Rich, please tell me what you think could be improved about the Affordable Care Act now that it's been upheld.
I'm very supportive of the Act itself, and we've had quite a long time to learn all about the Act. So I believe that really now the details are going to be the challenge. We have to figure out how to put it into place. We've spent a lot of energy debating whether it was a good thing. Now what I'm hoping is that our country can really get on with putting it into place. It's a wonderful Affordable Care Act. It requires quality. It requires physicians and hospitals to have high quality standards in order to be paid. And so I'm looking forward to being a part of that.
Judy Rich, CEO of Tucson Medical Center, Dr. Richard Johnson, Chief Medical Officer of Arizona Connected Care. Thanks so much for being with me.
Thank you, Mike.
Pleasure to be here.
In tonight's video postcard from photographer and editor Jay Blaine, we take you to the Marana Bluegrass Summer Concert Series.
I'm here to watch the Bluegrass Festival today. All over the Southwest, wherever you go, you'll find people playing bluegrass.
Love my wine, love my bass, love my biscuits, soft and gravy. Hey, like I see it, oh, like I see it, hey, like I see it, oh, like I see it.
I mean, I think there's a lot more people than I thought were going to be here, definitely. And it's cool because there's kids running around everywhere, which is nice. I'm from Marana. I haven't seen a lot of this in Marana recently, so I think it's cool they're doing it out here on this side of town.
You can get more news and information on our website, azpm.org. To comment on any story you saw tonight, click on it online and go to the bottom. We can also be reached via Facebook and Twitter. Coming up tomorrow night, preparations are underway for the 4th of July fireworks displays. We'll hear about some of the plans and safety procedures. And you'll meet a couple of members from the Student Veterans of America who discuss some of the programs that are trying to help returning service members transition back to civilian life. I'm Tony Paniagua from all of us at Arizona Public Media. Have a great night.